Pulmonary rehabilitation is an evidence-based comprehensive intervention recommended for patients with chronic respiratory disease who are symptomatic and have difficulty with activities of daily living. It reduces dyspnea, optimizes functional status, and reduces healthcare costs through improving patient self-management and stabilizing or reversing systemic manifestations of the disease. According to the Canadian Thoracic Society, comprehensive PR programs include patient assessment, exercise training, education for self-management, and psychosocial support. Pulmonary rehab programs also benefit individuals with other chronic lung diseases, such as, but not limited to, interstitial lung disease and lung cancer. The Canadian Thoracic Society recommends all Canadians with moderate, severe, and very severe COPD participate in pulmonary rehabilitation. Participation in pulmonary rehab is also recommended after acute exacerbations of COPD. Pulmonary rehabilitation programs are designed to provide patients with both an educational and physical component. Research recommends PR programs last a duration of at least 40 hours over 8 weeks. Each session should be 1.5 to 2 hours in length, with 3 sessions per week, with core components of education, exercise, and psychosocial support. The rationale for this project emerges from the high prevalence and projected increase in respiratory ailments such as chronic obstructive pulmonary disease among seniors in Canada. COPD is a vital concern affecting 1 in 9 over the age of 35 and increases to almost 1 in 5 seniors over the age of 65. As the average lifespan increases, the number of seniors living with and developing COPD will drastically increase. The number of Canadians diagnosed with COPD increased by 82% from 1.1 million to a little over 2 million between 2001 and 2012. COPD is a major cause of morbidity and mortality. In 2016, hospital costs associated with COPD admissions in Canada was $170 million, and it is projected to increase to $412 million by 2030. Canada is facing an increase in chronic respiratory diseases. As a report published by Health Canada explains, since many of the diseases affect adults over the age of 65, the number of people with respiratory diseases will increase as the population ages. The corresponding increase in demand for services will pose a significant challenge to the healthcare system. Globally, pulmonary rehab is accessed by less than 3% of people with chronic lung disease. Access to pulmonary rehabilitation is limited for many reasons, including but not limited to unavailability of PR services in the evening and night shifts, long distances to centers, inadequate number of centers, a complete lack of programs in some areas, limited equipment in centers, and limited governmental and social supports for patients. In Canada, only 8% of pulmonary rehab programs are offered in community-based recreation centers. With less than 3% of people living with lung disease being able to access pulmonary rehabilitation, how can we expand access to this important treatment?
In order to counteract the public health crisis of COPD among seniors, the medical care model must expand beyond existing clinical settings like hospitals. These facilities and the services offered within them are not currently reaching the majority of seniors who would benefit from treatment. This research project objective is to evaluate a health service model that can successfully impact the efficacious self-management of COPD among seniors while operating in educational and private settings. Pulmonary rehabilitation programs exist, but accessibility and wait times continue to be barriers for patients in need of care. What is innovative about this program is engaging students to lead the PR program. This project is innovative in how it seeks to use available resources, in this case students, to address the need for greater access. This novel approach provides service through delivery of care to participants with involvement of healthcare students through experiential learning and interprofessional education in the community setting. This serves to provide healthcare students interdisciplinary hands-on training opportunities and to provide alternative clinical experience outside of acute care institutions. The interprofessional practice provides students with the opportunity to see what each discipline has to offer and how to work together as a part of an efficient healthcare team. It enables students to be able to be more confident with teamwork. For many students, it provides a relaxed atmosphere to practice and refine the skills needed to be successful in the workplace. Having multi-professionals working together to deliver this program leads to a camaraderie that can be used within the hospital setting upon graduation. How does one go about setting up a student-infused pulmonary rehab program in your area?
The first step in setting up a pulmonary rehab program in your educational institution is finding appropriate personnel to oversee the program and the students delivering it. Previous studies have shown that to achieve the best outcomes, the setting is less important than the skill and commitment of the staff who deliver the program. Therefore, careful consideration should be taken when choosing personnel. Research does not support any one healthcare profession or a combination thereof to coordinate such a program. Respiratory therapists are commonly chosen as coordinators of pulmonary rehab programs. Once you have your staff, it's time to choose a location. Are you going to be starting from scratch or setting up in an existing gym or community center? There are many variables to consider when selecting a venue for PR. Is there existing available space in your institution? What is your budget? Are there recreational facilities already in place that you can partner with, especially in rural areas? Things to think about when selecting a venue. Parking. Is there close and available parking? Building accessibility. Is the space close to an entrance or exit, as well as bathrooms? You should look at the space and size of the venue. The costs of rental or setup. That would include insurance and custodial fees. Is there equipment already available? And is there oxygen available? Is the supply there, or do you need to rent equipment? Then it is important to consider all the student programs available in your area and work closely with instructors from local educational programs to optimize student participation. Try to schedule at least 2 students daily, although we found the more students involved, the better the experience for the participants. Having that one-on-one attention really brings out the most enjoyment and effort in the participants, therefore garnering better results. Healthcare students are involved in leading the group-based exercises, monitoring vital signs, and providing education to participants. They should have completed all the required courses for community clinical placement prior to entering PR. Students should adhere to a preset curriculum and exercise routine. This will ensure consistency in program delivery and should be provided to all students well in advance to entering PR. We utilize the Living Well with COPD platform, which is available publicly and free of charge.
To date, we have completed 6 of 8 clinics encompassing over 140 students and over 60 participants. Although not all of the data has been analyzed, the results to date look promising. 2 of the measures we used for evaluating the program are the St. George's Respiratory Questionnaire and the 6-minute walk test. These 2 measures were performed 1 week prior to the commencement of and 1 week following the completion of pulmonary rehab. The St. George Respiratory Questionnaire is a widely used tool developed to measure health impairments in patients with asthma and COPD. The questionnaire results in 4 scores: symptoms, activity, impacts, and a total score. Data from completed clinics has shown a statistically significant and clinically meaningful reduction in symptoms and a statistically significant reduction in perceived impact the disease has on activity and impact on their daily lives. Finally, the individual's total score, a perception of the overall impact of the respiratory disease on their life, also showed a statistically significant decrease. 6-minute walk test is a test introduced by the American Thoracic Society used to assess aerobic endurance. The distance walked in 6 minutes is compared pre- and post-intervention to determine changes in performance. The test is used in many conditions like COPD. With participants, there was a statistically significant increase in average distance walked, approximately 51 meters or 167 feet. There was also a statistically significant increase in subjective perceptions of health. As data indicates, this clinic involving many health students is an efficacious way to deliver pulmonary rehab. Through focus groups, we have been able to collect participant feedback at the end of each 8-week clinic. Positive feedback was received from all participants. Participants expressed their enjoyment of having students infused in pulmonary rehab. They enjoyed their youthful energy and enthusiasm. They also enjoyed the individualized attention they received. Although improvements may seem insignificant to the average person, some milestones reported by our participants include being able to go grocery shopping for the first time in many years, being able to carry laundry upstairs. One participant reported she was able to use breathing techniques learned in class to improve her shortness of breath and avoided calling an ambulance. She also decided on not selling her family home as she was able to navigate the stairs without shortness of breath. 2 participants gained the strength and confidence to travel 1,500 kilometers to receive life-saving double lung transplants. As one participant stated, "Before pulmonary rehab, I had no life, but worse, I had no hope. By applying what I learned daily, my life is fantastic. I am forever grateful."
Our program has demonstrated a successful implementation of an interprofessional, community-based student-infused PR program. With the increasing prevalence of chronic pulmonary conditions, it is necessary to consider this innovative model as a tool for improving access to pulmonary rehabilitation, as well as preparing future healthcare graduates through experiential learning.